everyone. Good morning or evening, classmates and Dr. Val. Today we'll be discussing on the topic of chemotherapy versus targeted chemotherapy for treating cancer. I am Bethlyn, and with me is Chloe, Jiayang, Irvin, Shamira, Zhi, Xiangning, and Yishen. Together we are Team F. Here are briefly the areas that we'll be covering, and I will now pass the time to Irvin to start us off with the introduction.
Thank you, Beth. I will now take the time to give a brief introduction to what chemotherapy is. So what is chemotherapy? Chemotherapy refers to the use of any drug to treat any disease. But to most people, the word chemotherapy or chemo will refer to drugs used for cancer treatment. It is important to know that not all medicines and drugs to treat cancer work the same way. In the past, it used to be such that the only kind of drug that could treat cancer was traditional or standard chemotherapy. But now, there are lots of different kinds of drugs used to treat cancer. While traditional or standard chemotherapy is still the best way to treat many cancers, different kinds of therapies and treatments may work better for others. So what are the goals of chemotherapy? First up, there are three main goals, and the first one is cure. For cure, if possible, chemo is used to cure cancer, meaning that the cancer is totally destroyed. Although cure may be the goal in these situations, and is the hope of many who have cancer, it doesn't always work out that way. It often takes many years to know if a person is really cured of their cancer. If a cure is not possible, the next goal of chemotherapy treatment is to control the disease. In these cases, chemo is used to shrunk tumors and or stop the cancer from growing and spreading. In many cases, the cancer doesn't completely go away, but is controlled and managed as a chronic disease, much like heart disease or diabetes, and in other cases, the cancer may go away for but resurface at a later timing. Lastly, chemo is also used to ease symptoms caused by the cancer. This is also known as palliation, palliative chemotherapy, or treatment with palliative intent. When the cancer is at an advanced stage, which probably cannot be controlled, and has spread, the goal of giving chemo may be to improve the quality of life or to help the person feel better. For instance, chemo may be used to shrunk a tumor that is causing pain or pressure so the patient feels better and has less pain. Next up, there are also many factors for treatment when doing chemo. Some of the factors are listed here, such as the type of cancer, the stage of the cancer, the results of the test, also known as biomarkers, a patient's age, a patient's condition and history, and whether the patient has any other previous treatments. I'll now pass the time to Xiangning to talk about what is targeted cancer therapy. Xiangning, please.
Thank you, Irvin. Now I'll be talking about targeted cancer therapy. What is targeted cancer therapy? It is a type of cancer treatment that uses drugs to target specific genes and proteins involved in the growth and survival of cancer cells. They do not attack normal, healthy cells. Next, the goals of targeted cancer therapy are as follows. They are exactly the same as the goals for chemotherapy, which are cure, destruction of the cancer, control, the controlling and management of the disease, and palliation, the easing of the symptoms of cancer. Next, we'll be talking about the factors for treatment via targeted cancer therapy. The factors for treatment via targeted therapy is similar to those of chemotherapy, such as the patient's condition and history, and it also includes the type of cancer and the type of tumor. Type of cancer. Not all cancer is suitable for treatment using targeted therapy. Examples of cancer that can be treated using targeted therapy are breast cancer, colorectal cancer, and lymphoma. But this treatment is ineffective in treating other types of cancers, such as brain tumors. Type of tumor. As targeted therapy drugs rely on the identification of biomarkers within the cancer cells that the drug targets, as long as the cancer cell in one's body does not contain that particular biomarker, the drug cannot be recommended since it doesn't eliminate cancer cells. For example, in breast cancer, when a patient's cancer cell doesn't have the HER2 protein, the targeted therapy drug, such as the monoclonal antibody trastuzumab, cannot be recommended. Now, I'll pass on the time to Shamira, who will be covering the different types of chemotherapy and targeted therapy treatment.
Thank you, Xianing. So now I'll be taking the time to talk about the different types of chemotherapy and targeted therapy. But first, I'll be talking about the different modes of chemotherapy treatment. First, we have primary therapy, which is used as an anti-soul cancer treatment in highly sensitive tumor types. Next is neoadjuvant therapy, which is administration of drug before the main treatment such as surgery. Next is a concurrent therapy, which is given simultaneous to radiation to increase the sensitivity of cancer cells to radiation. And lastly, it is the adjuvant therapy, which is administration of drugs after surgery to kill any remaining cancer cells. Moving on, I'll be talking about the different types of chemotherapy drugs. First, we have the alkylating agents. These agents damage DNA and prevent mitosis. Next is the antimetabolites. These agents interact with the S phase and substitute normal RNA and DNA with other amino acids, thereby interfering with cell replication or proliferation. Thirdly, we have the anti-tumor antibiotics that inhibit the enzyme that bring about the DNA replication. Next is the topoisomerase inhibitor, which inhibit the enzyme topoisomerase that usually help untangle DNA strands so that they can be replicated. We also have plant alkaloids, which is known as mitotic inhibitors that interrupt the end phase of the cell cycle and inhibit mitosis. Next, I'll be talking about the different types of targeted therapy. The first one is monoclonal antibodies, which is a protein produced in the lab which is designed to mimic the way antibodies produced by B cells in the immune system to find out and attack the genetic features called antigen on bacteria and infection cells. Next is signal transduction inhibitor, which block the activities of molecules that participate in signal transduction, the process by which a cell responds to signal from its environment. Next is called gene expression modulators, which modify the function of protein that plays a role in controlling gene expression. Next, it's apoptosis inducer, which cause cancer cells to undergo a process of controlled cell death called apoptosis. It is one method that the body uses to get rid of unwanted or abnormal cells. But cancer cells have a way to avoid apoptosis. Next is angiogenesis, which is inhibitor to block the growth of new blood vessels to tumor. And lastly is immunotherapies, which trigger the immune system to destroy cancer cells. Now, I'll pass my time to Yi to talk about the mechanism of chemotherapy.
So let's firstly touch on the mechanism of chemotherapy and targeted cancer therapy. So for the mechanism of chemotherapy, there are many different kinds of chemotherapy or chemo drugs used to treat cancer, either alone or in combination with other drugs or treatments. Chemotherapy can be given intravenously, through injection into the spinal fluid, orally coming in pills, capsules or liquids, or topically coming in cream to rub onto your skin. So what does chemotherapy do to our cells? Cell division, also known as mitosis, is where a parent cell splits into two new daughter cells. And what chemotherapy does is to kill cells that are in the process of splitting into two new daughter cells, in which mitosis. For which, it is only normal for children, where they are growing and all, for their tissues to be growing and multiplying to reach their adult size. However, once we are fully grown, most of our body cells do not divide and multiply as much, only for certain processes and only for tissue and cell repair. However, in cancer patients, these cancer cells will divide uncontrollably until there's this mass of cells, which becomes a lump, and this lump is called a tumor. Now, there are two main categories of chemotherapy drugs. There's the cytotoxic drugs and the cytostatic drugs. Cytotoxic drugs, as the name says, kills cancer cells, thereby shrinking the tumor. Cytostatic slows down cancer growth, thereby inhibiting or slowing down the growth of a tumor. However, cytostatics are more commonly used for targeted cancer therapy. These drugs vary significantly in their chemical compositions, how they are prescribed and its dosage, their effectiveness in treating certain cancers, and their side effects. So chemotherapy drugs essentially will circulate throughout your body in the bloodstream so you can treat cancer cells almost anywhere in the body. Chemotherapy drugs can even reach cancer cells that aren't detected in examinations, and that can therefore not be targeted in surgery or radiation. This is known as systemic treatment. Some drugs kill dividing cells by damaging the part of the cell's control center that makes it divide. This includes tumor suppressor genes, proto-oncogenes, or in cancer cells, oncogenes, which are found in the nucleus. On the other hand, other drugs interrupt the chemical processes involved in cell division, in which some will damage the cells while they are in the midst of DNA replication before the cell is split into two.
Some patients will have a combination of different chemotherapy drugs, including those that damage cells at different stages of cell division, and this actually increases the frequency of killing more cancer cells. So some cancers actually require chemotherapy drugs to be administered at the site of cancer, and this is known as local chemotherapy. These drugs can be applied as topical ointments or creams for cancers like basal cell carcinoma, which is a common skin cancer. When a cancer involves cerebrospinal fluid, also known as CSF, chemotherapy drugs can be given directly into the CSF, such as injecting cytostatics in the spinal canal. For such cases, chemotherapy given intravenously or orally are typically unable to cross the CSF and therefore unable to treat these cancer cells. For patients who are required to go through many chemotherapy cycles, long-term drug administration can be done through a port. This port is a small container inserted under the patient's skin, and it is connected to a large vein with a small tube. Infusions can be connected to the port, saving the need for the countless venipuncture procedures required for every chemotherapy session. Now, Isha will be sharing with you about the mechanism of targeted cancer therapy.
Thank you, Ziyi. Now I'll be speaking about the mechanisms of targeted cancer therapy. As the name suggests, targeted cancer therapy focuses on specific areas or substances in cancer cells, or they prevent metastasis by preventing the growth of cancer cells. Here are some ways targeted cancer therapy drugs work. 1. They can inhibit or turn off chemical signals that tell the cancer cells to grow and divide. 2. They alter proteins within the cancer cells so that the cells die. 3. They stop making new blood vessels to feed the cancer cells. 4. They trigger our immune system to kill the cancer cells. Or 5. They carry toxins to the cancer cells to kill them, but not normal cells. Now let me elaborate a little more on each point. Firstly, targeted cancer therapy drugs can interfere with cell signaling processes. These drugs are known as signal transduction inhibitors. In some cancers, the malignant cells are stimulated to divide continuously without being prompted to do so by external growth factors. And so, signal transduction inhibitors interfere with this inappropriate signaling. There are several targets for signal transduction inhibitors, including cell surface receptors and intracellular biochemical molecules. By interfering with this inappropriate cell signaling, metastasis is prevented. Next, we have gene expression modulators, which are drugs that modify the function of proteins. These proteins play a role in controlling gene expression responses to signals that the cell receives. Thus, by modifying the function of these proteins, cancer cells' growth is being slowed down. Thirdly, some drugs stop making new blood vessels to feed the cancer cells. These drugs are known as angiogenesis inhibitors. Angiogenesis inhibitors interfere in blood vessel growth in several ways. Some are monoclonal antibodies that specifically recognize and bind to a signal protein for vessel growth, also known as the vascular endothelial growth factor, VEGF. When VEGF is attached to these drugs, it is unable to activate the VEGF receptor, and thus the growth of new blood vessels is halted. Other angiogenesis inhibitors bind to VEGF and/or its receptors, as well as to other receptors on the surface of endothelial cells. Some also bind to proteins in the downstream signaling pathways, blocking their activities. Some angiogenesis inhibitors are immunomodulatory drugs that also have anti-angiogenic properties. In some cancers, angiogenesis inhibitors appear to be the most effective when combined with additional therapies. Because angiogenesis inhibitors work by slowing or stopping tumor growth without killing cancer cells, they are given over a long period of time. The immune system can also be triggered to destroy cancer cells. This is done by immunotherapy. A reason why cancer cells thrive is due to their ability to evade the immune system. Thus, there are many different types of immunotherapies to help boost our immune system. Immune checkpoint inhibitors block checkpoints, which are a normal part of the immune system and keep the immune responses from being too strong. By blocking them, these drugs allow immune cells to respond more strongly to cancer. Next, we have T-cell transfer therapy, which involves selecting the most active immune cells, boosting their function in the laboratory, cultured in large batches, and then placed back into the body through a needle in a vein. Monoclonal antibodies mark cancer cells so that the immune system will better recognize and destroy them. Treatment vaccines and immune system modulators serve to enhance and boost the immune system of an individual. Some monoclonal antibodies do not kill cancer cells directly, but instead deliver toxic molecules that causes the death of cancer cells. Once the antibody has bound to its target cell, the toxic molecule that is linked to the antibody, such as a radioactive substance or a poisonous chemical, is taken up by the cell, ultimately killing that cell. This toxin will not affect cells that lack the target for the antibody, which is the vast majority of cells in the body. Lastly, another type of cancer therapy is known as hormone therapy. Hormone therapy slow or stop the growth of hormone-sensitive tumors which require certain hormones to grow. They act by preventing the body from producing the hormones or by interfering with the action of the hormones. Hormone therapies have been approved for breast cancer, prostate cancer, and womb cancer. As for the differences in mechanisms between chemotherapy and targeted cancer therapy, well, we would like you to think about that. Now, I'll pass my time on to Chloe, who will speak about the treatment procedure.
Thank you, Yishan, for the insightful sharing of the mechanism of target cancer therapy. Now, allow me to share with you the general timeline of chemotherapy and target cancer therapy. So for the general timeline of chemotherapy, typically, cancer patients will have to have their blood work done around a day or a week before the chemotherapy treatment. So the blood work done actually comprises of 3 different parts. The first part will be the complete blood count. Second part, it will be the chemistry profile. And the third part, it will be the necessary cancer markers. So now, the entire course of chemotherapy takes place for around 3 to 6 months, and between that, it comprises of about 4 to 8 treatment cycles. Each treatment cycle is about 3 weeks long. That is, a dose of chemotherapy on the first day of the 3 weeks, and the remaining time of the 3 weeks will be used for recovery time. So this is considered as one treatment cycle, and this treatment routine will be continued for the subsequent few treatment cycles. So now you may be wondering, why is recovery time so long, and is it even that important? So let me answer your question. So yes, recovery time is very important, and the reason for that, there are 3. Firstly, it allows for chemotherapy to kill more cancer cells. So at any point in time, cancer cells will either be resting or they will be dividing. And chemotherapy can only kill the cancer cells that are dividing, and hence the cancer cells that are resting, they will not be attacked by chemotherapy at all. So when the second treatment comes around, the cells that were resting would likely be dividing, and hence the treatment can actually come in to attack on these cells. The second reason as to why recovery time is so important is because recovery time actually allows for our healthy cells to effectively heal and recover from the chemotherapy treatment. Normal cells actually recover from the damage of chemotherapy more quickly and more effectively than cancer cells. So damage to the cancer cells should progressively build up without causing much permanent damage to the normal cells. Lastly, the side effects from too many chemotherapy drugs are very severe, and giving treatment too soon after another can cause a lot of side effects or the risk of having side effects. However, there are some cancers that are treated with less recovery time between the cycles, and these are known as dose-dense schedules. It can make the chemotherapy more effective against the cancer, however, it also increases the risk of side effects. So now, let me take you through the general timeline of target cancer therapy. So target cancer therapy actually comes in the form of small molecule drugs in the form of, say, pills or capsules given to the patients where the patients will swallow. Or it can also come in monoclonal antibodies given to the patients through intravenous. The treatment of targeted therapy depends on 3 different things. Firstly, your type of cancer and how advanced it is. Secondly, the type of targeted therapy treatment. And lastly, it will be how the body actually reacts to the treatment. And with that being said, there isn't a very definite timeline for the targeted cancer therapy, but the treatment can be given daily, weekly, monthly, or given like what I covered in chemotherapy, it can be given in cycles as well. So now let me share with you on a series of alternative cancer therapies that I found rather interesting. Firstly, there is definitely surgery, and the goal of surgery is to remove the cancer or as much of the cancer as possible. Secondly, we have the radiation therapy. Radiation therapy actually uses high-powered energy beams such as X-rays or protons to actually kill the cancer cells. Radiation treatment can come in the form of a machine outside your body through external beam radiation treatment, or it can be placed inside your body through brachytherapy. The next treatment that I would like to share is quite interesting, and it is cryoablation. And cryoablation is a treatment that actually kills cancer cells with cold. That's surprising, right? Well, during cryoablation, a thin wand-like needle known as the cryoprobe is actually inserted through the skin and directly into the cancerous tumor. A gas is then pumped into the cryoprobe in order to freeze the tissue. Then, the tissue is allowed to thaw. And this continued freezing and thawing is actually repeated for several times during the same treatment session in order to actually kill the cancer cells. Lastly, I'd like to share about radiofrequency ablation. Now, this radiofrequency ablation is quite different from cryoablation, and this is because this treatment actually uses electrical energy to kill the cancer cells through, you guessed it, heat. During radiofrequency ablation, a doctor actually guides a thin needle through the skin or through an incision and into a cancer tissue. The high frequency energy process actually passes through the needle and actually causes the surrounding tissues to heat up, effectively killing the cancer cells nearby.
Thank you, Chloe. So let's talk about which type of cancer patient goes for which therapy. Well, actually, the answer is really very fluid. In a sense, it depends much on the doctor or physician's diagnosis, as well as, interestingly, influence from the patient's preferences. So before I start, we have to understand that there is no exact same treatment for two cancer patients, and that there are many different ways to treat cancer. So when may a patient be recommended to have chemotherapy? Generally, most cancers can be fought by the use of chemo. Here are 4 main reasons why they may be recommended for this treatment, and follow me through numbers 1 to 4. Firstly, it could be simply because we want to shrink the cancer before surgery. The aim of this is so that the patient would need less surgery or to make it easier to get all the cancer out. And shrinking the cancer might also mean that radiotherapy would be carried out to a smaller area of the body, which is an advantage. This method of having chemo before surgery is called neoadjuvant or primary treatment. Secondly, unlike the first reason, it is to have chemo after a surgery was done. The aim of this is to lower the risk of a comeback in the future. This chemotherapy circulates throughout the patient's body and kills off any cancer cells that may have broken away from the main tumor before operation. And this is called adjuvant treatment. Thirdly, a patient might have chemotherapy as a treatment all on its own, without surgery. This is for types of cancer that are very sensitive to chemotherapy, such as blood cancer. And lastly, the doctor may suggest chemo if there is a chance that the cancer might spread in the future or it has already started to spread. Sometimes cancer cells break away from a tumor and may travel to other parts of the body through the bloodstream or lymphatic system. There, cells may settle and develop into new tumors, and these are called secondary cancers or metastases. This chemo happens through circulation of drugs in the bloodstream around the body to treat any cancer cells that may have spread and settled in other places. So who goes for targeted therapy then? To put it simply, if the tumor present in the patient has cancer cells which contain target, which we have already found drugs for, then they may be recommended for targeted therapy. The doctor will need to test the tumor to see if it has any targets. Sometimes they'll do a biopsy, which is to take a small sample from the tumor and check it in the lab. Targeted therapy is often given along with other treatments. It is important to note that even if the patient has the same type of cancer as someone else, he or she might not have the same target. Examples of cancer which we have treatment for are chronic myeloid leukemia, CML for short, and this was actually the very first cancer to be treated with this method. Also, certain colorectal, lung, head, and neck cancers, and also breast cancers are included as well. So now let's think of some things doctors or patients consider when deciding which treatment is best. As the physician selects the treatment, there are many medical factors that go into the final decision. The size of the tumor, for example, it tells us the prognosis, or in other words, it could help us tell the severity of the cancer. In general, the smaller the tumor, the better the prognosis tends to be. For example, tumor size is part of the breast cancer staging system. In the TNM staging system, a T followed by a number shows the size of the tumor. Patients' age and what other medical conditions they may have are pivotal steps in determining the treatment. Elderly patients with advanced cancer must balance the potential risk and benefits of treatment when deciding whether or not to have chemo. The response rates to aggressive chemotherapy are similar in all patients, so older patients would have to undergo the same strong effects treatment may entail. So the question is if the older person body is really able to take it or not. And of course, when it comes to the patient itself, the exact type of cancer and the extent of involvement affects the decision. We must note that difference in survival rates has to do with a particular cancer's ability to spread or invade into other parts of the body. Lastly is seeking a second or even a third opinion from other oncologists, and many doctors actually do encourage it. Different oncologists may have different experiences with various treatments, so seeking multiple opinions can help patients make a decision or confirm the current treatment plan they have. So now I'll pass the time to Shamira, who is covering the risk and limitations.
Thank you, Beth. As all of you know, targeted therapy and also chemotherapy actually helps to kill the cancer cells. However, there are risks and limitations to every treatment. First up will be chemotherapy. Chemotherapy can damage some healthy cells in the body, such as the blood cells, skin cells, and stomach cells. This can cause a range of unpleasant, long-lasting, and late developing side effects. There are also common side effects such as fatigue, nausea, vomiting, diarrhea, hair loss, pain, fever, and etc. Many of these side effects can be prevented or treated and will subside after treatment ends. An example of long-lasting and late-developing side effects is damage to lung tissue, nerve problems, infertility, kidney problem, nerve damage, and risk of second cancer. So another risk of chemotherapy is adverse effects such as the immunosuppression, which is the reduction of efficacy of the immune system, and myelosuppression, which is the suppression of the bone marrow. An example of condition that affect the immunocompromised patient is neutropenic colitis. The main elements in the disease onset appear to be intestinal mucosal injury together with neutropenia and the weakened immune system of the patient. This can be due to chemotherapeutic agents that can cause direct mucosal injury or can predispose to distension and necrosis, thereby altering intestinal motility. Now, I'll be talking about the limitations of chemotherapy. So the first one is it's non-selective as it affects all rapidly dividing cells. Next, cancer cells can be resistant to chemotherapeutic agent. There are two types of resistance. The first one is primary resistant, which means that there are no response from the very first exposure. An example will be malignant melanoma. Next is acquired resistant, which during the duration of the therapy. This can be due to the adaptations of the tumor cells or due to mutation in one or more genes. Moving on, I'll be talking about the risks and limitation of targeted therapy. For the risks of targeted therapy, patients can develop common side effects such as diarrhea and liver problems. Other side effects might include problems with blood clotting and wound healing, high blood pressure, fatigue, nail changes, mouth sore, loss of hair, and skin problems. Skin problems might include rash or dry skin. Many of these side effects can be prevented or treated and will subside after treatment ends. Moving on, I'll be talking about the limitation of targeted therapy. The first one is cancer cells can be resistant to them. The resistance occurs in two ways. First, the target itself changes through mutations so that the targeted therapy no longer interacts with it. Second, the tumor finds a new pathway to achieve tumor growth which does not depend on the target. Fortunately, there is a solution to prevent resistance by combining targeted therapy with one or more traditional chemotherapy drugs, such as Herceptin, which is a targeted drug therapy, combined with docetaxel, which is a chemotherapy drug. This is used to treat women with metastatic breast cancer. The second risk is drugs for some identified targets are difficult to develop because of the target structure and or the way its function is regulated in the cell. Example, RAS, a signaling pattern that is mutated in as many as 1/4 of all cancer. Unfortunately, there are still no solution till date. Lastly, the limitation is that the treatment will not work if the tumor does not have the target. Now, I'll pass my time to Chia Yang to talk about the costs of chemotherapy and targeted therapy.
Thanks, Yamira. Next, I'll be talking about the cost of each treatment. Let's start with chemotherapy. For chemotherapy treatments, one may need 4 to 8 cycles to treat a cancer. A series of cancers is called a course. A course can take 3 to 6 months to complete, and you may need more than one course of chemo to beat the cancer. That means many cycles. The average cost of chemotherapy in Singapore is around $1,500 per cycle. The total cost, including chemotherapy, surgery, and radiation, could average between $11,000 to $12,000 a month. Out-of-pocket costs are usually a small fraction of this, but seeking more effective treatment from a specialist may increase costs. Comparatively, for targeted therapy, the cost of the most popular therapy, which is the use of signal transduction inhibitors to cure cancer, causes an average of $2,800 per week, while the use of gene expression modulators average $7,000 per week. The cost of treatment using angiogenesis inhibitors for cancer ranges between $6,000 to $15,000 per person per month. The average cost of immunotherapy cancer drugs is $250,000, and the average cost of using monoclonal antibodies for cancer is over $100,000 per patient throughout the course of treatments. The cost of hormonal therapy varies greatly depending on the cancer of the patient, but it is commonly said that one that opts for such therapy can go bankrupt instantly, so securing MediSave and MediShield coupled with outside high-return medical insurance is sincerely advised. Having heard so many scary figures that us students cannot even yet imagine having in our bank accounts, what are some post-lifestyle changes that patients have to adopt? Our team has compiled the following 5 changes that all cancer survivors observe. First off, remain active. Regular exercise during and after cancer treatment can help reduce fatigue, weight gain, and loss of strength. In addition, try to avoid sitting or lying down for long periods. Second, sleep. Having at least 7 hours of sleep improves health, mood, memory, coping ability, weight control, and attention span. Third, diet. Eating a diet with fresh fruits and vegetables and other unprocessed low-fat foods can reduce the risk of heart disease, high blood pressure, obesity, and diabetes. Most important of all, limit alcohol to 1 drink per day. Fourth, stress management. Reduce your stress level can help you maintain your physical and mental health. Many picked up meditation and yoga. Some useful tip is to find small periods of time to reflect throughout the day. This can include taking a moment to be mindful while washing your hands, brushing your teeth, or even waiting at the traffic light. Fifth, accept emotional support. Having a network of supportive people is very beneficial for your health, especially emotional support. Studies have compared people with cancer who had the most and least social support. Those with the most social support had better quality of life and live longer. So, offer cancer patients your listening ears, encourage them to join support groups. Following are a list of cancer support groups that are offering help in Singapore. With that, I will now pass back the time to Beth, who will conclude our seminar.
Thank you, Tia Yang. Now let's close up with our conclusion. Every patient is unique, and the goal is for the patient and physician to determine the right treatment, whether that includes immunotherapy, chemo, targeted therapy, just to name a few, or maybe even various combinations of the many methods that have been discovered. Hence, there is no real way to conclude whether chemotherapy or targeted therapy is better. Also, there is no same treatment for two patients because there are many other medical factors involved. And ultimately, our goal for every patient is to be able to eliminate the presence of the cancer in their body. Hence, with that, put yourselves in the physician's shoes and make a decision. We have prepared a little case study for you to work with, and relax, there is no right or wrong answer, just give us a reason for your decision. The next few slides are instructions, and we will just want to thank you for persevering all the way to the end, and really good luck for your upcoming exams. Thank you.